of veterinary medicine at Longevity Veterinary Center on Route 10 in Whippany. It's so great to have you. I love to roundtable, with a lot of our professionals, a lot of our veterinary professionals at Longevity. I'm going to put Rosie down. She's getting a little boisterous because there's so many things to talk about. And it's funny because what I said, I'm going home. I've got Dr. Fiorenza, Mike Bufis, who works at WDHA, is like, oh, my dog is going to be seeing her this afternoon. He's bringing in Hella
Awesome.
to see you. So it's such a small world. And not only do you treat, Hella's a pup and she's coming in, I think, for her last series of vaccinations. So not only is that something that you do, but I love all of these sort of non-traditional and incredibly exciting veterinary things that are happening now. I have often wondered about acupuncture for dogs that unfortunately are no longer with me. I lost one a few months ago and one last year. And I know that you are certified in veterinary acupuncture. The problem for me always was that you can never really find at your regular vet someone who is there on a regular basis. This person comes once a month. This person comes every other Saturday. They don't have an appointment until August, and you're sitting there going, it's January. What am I supposed to do until August? So I'd like to start in talking about acupuncture because I think it is such a crucial and important thing for our pets. So talk to me about how you got involved and why it can add to the quality of life for our best friends.
Sure. I'm very happy to be here. Nice to meet you. I didn't realize that they were at Hella, right? That
Hella,
Hella was with you guys. So
she
that's so funny.
is. Yeah.
I'll have to say, hey, my interview went great. Good.
Yeah, yay.
So I have been doing acupuncture for about 4 years now. And I got into it through kind of a combination of what I was seeing in practice and also through my own health issues, where I just felt like for a lot of chronic problems, Western medicine was not really enough. It wasn't really giving us the relief that I felt, um, my patients and myself should have or could have. A lot of the issues like arthritis and chronic pain, a lot of chronic skin issues, a lot of anxiety issues, just a lot of the chronic problems that we see that just don't seem to respond to just, a pill or something like that. And I just felt like I wasn't really giving my patients and my clients what I felt they deserved. So I started to branch out and look for other tools to put in my toolbox. I grew up doing yoga, so I was always kind of in that mindset of a little bit more of a holistic mental, state, and that just really fit for me. Acupuncture was something, or acupuncture training was something I wanted to do for many years. Post graduation from vet school, I actually was in the complementary and alternative medicine club and the one course that we had while I was at Cornell in vet school.
How exciting
So
is that too? That has to be
yeah,
so exciting because I would imagine it's like windows of a computer opening up for you all the time and just seeing all
yeah.
of these different phenomenal options that can take you into the next phase of veterinary medicine.
Yeah, exactly. And I kind of explain it to some of my clients as almost like being bilingual because your brain is thinking in two different ways. You're thinking in the Western way and you're thinking in the Eastern way. And with practice, you just become fluent in it and you can think in two different ways. So it's nice in that respect because it does just broaden everything. And I also, tell people I have people who come in who want homeopathy or want like other specific modalities. And I say to them, listen, guys, I can't do everything. I focus on acupuncture, I focus on herbal medicine, supplements, food, and there's so much else out there, which is both frustrating as a practitioner because you want to be able to do all the things, and it's just not possible. You have to kind of fine tune and take one thing at a time and get good enough in it that you feel comfortable moving on to the next thing. But there's also other practitioners out there who do those things. But this comes back to what you were saying. There's not enough of us doing it because there's so many different modalities to work with. And certain people are pulled towards certain ones. And a lot of conventional veterinarians don't. I think a lot of them are much more open to it than they used to be, but it's not really taught in vet schools. Um, I've been out for like a decade now, so I think there might be a little bit more, um, discussion about it in vet schools, especially acupuncture. That's probably one of the most popular ones. But it is hard. Like there's so many things that you want to learn and use for your patients, and you're kind of limited by time. I always
Yeah.
joke, I'm like, I need
Yeah.
two of me, one to just
Yeah.
do all
Yeah.
of this, the continuing ed,
Yeah.
and then
Because
one to
you're
just be at the
there. You're there treating
hospital.
patients all
Yeah.
the time. So what would be some of the most common things that people may come in for acupuncture for? That's part one of my question. And then also part two, I would imagine that there's a certain preventive element for preventing things, to come up in the future for your pet, whether it's a dog or cat. I mean, can this be done on any pet, any size pet? So just give us a little more clarity on that. First, of course, what would be the most common thing? I would think that for me, it's like my dog is having trouble walking. That would be the most
Mhm.
common thing that I think people would probably come for. Yeah.
Yeah, I would say joint issues, mobility issues in general are probably the number one cause. Um, I would I would say that skin issues are probably the second most common in general
Wow. I see. I didn't think of
for,
that. I actually didn't think of that, but now it makes sense that you're saying that.
yeah, and I would say I do tell people, I find that acupuncture can be helpful in combination for dogs with skin issues, but I don't find that it's the most useful. I do tend to focus on food and herbs there, but I will do acupuncture in combination because it does help. Um, and then I would say probably GI issues are maybe number three. Those and then cancer. I would say those are probably the top four that I see. But it can be used for anything. I've used it for kidney disease, for dementia in older dogs,
Wow.
heart
Wow.
disease, you name it. I always tell people, I'm like, I'm happy to try, even
Yeah.
things that I've
Yeah.
never used it with. It's always it really helps the body to turn on its own healing mechanisms. So it's very helpful for so many things.
Yeah. Is it
Um,
something that you would recommend as a preventive measure for a dog, say to come in once or twice a year? Is it something that you would recommend to kind of keep
you
the good
Yeah,
flowing?
you definitely can because it helps to prevent the bigger issues from occurring or slows them down. I don't tend to use it preventatively a lot, which I guess is kind of unfortunate, but it can be, I guess it can be a little bit more difficult. Some people do come in looking for it, some people don't. I think a lot of people do think of it more for treating disease than preventing.
Yeah.
So it depends on the client, some, especially us here, being so integrative and so holistically minded. We do have a lot of clients that are more interested in some of those things as a preventative treatment. Um, but it can. We talk about our patients as having different constitutions, meaning everyone has essentially their own personality, and we group them into five big ones based on the five elements in Chinese medicine. So you can treat based on that constitution to prevent problems that are more common in those constitutions, and also to treat whatever you're noticing based on tongue and pulse reading, which tells us a lot about essentially blood flow in the body. And that's where a lot of the power of our treatment comes from, is being able to unblock and smooth the flow of blood and nutrients to the tissues. And then to get back to your other question about, who can be treated. In theory, anyone. I do treat a lot of dogs. I do treat a fair number of cats too. Cats usually they're pretty amenable to it. I have, the occasional cat that is so scared at the vet that I will say, okay, we can try, but we'll have to see how they respond. Same with the dogs. It's rare that I have a dog that I can't do acupuncture on, but occasionally they just are not happy with it. They're very, very anxious to begin with. And then I've treated rabbits, chinchillas. Um, I have colleagues who've treated reptiles and birds. We
Wow.
actually, yeah,
Wow.
penguins and like really fun stuff. People who work at the zoos. I've done acupuncture on the goats at one of the zoos near me a couple of times. So you could use it on anything.
Yeah, on any little critter. So, all right,
Hmm.
so people are looking and thinking of what they see someone or something getting acupuncture, and they're seeing the needles boing 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 going in. And of course, the first thing you're going to say is it painful? So talk
Yes,
about the
yes.
process. What is the process like for and I hate to call them humans, for an owner,
Mm.
owner humans, coming in with their loved one. And so what is it like? Do they come in with you? Is it painful for a dog to have a needle go in? Is it not painful at all? Give us a little bit of an overview there.
Yeah, sure. Um, Most clients come in. Occasionally, I have one that's like so terrified of needles that they don't want to be present. So, and I'm
Really?
like, okay,
Yeah.
that's fine. Yeah, I think it's only happened a handful of times. But most clients want to be in with their pet during the sessions. So, they're always welcome. Um, I have my own acupuncture room here. Dr. Satish and I share it. It's our acupuncture energy room. So it's a little dimmer, it's a little quieter. It's covered in crystals and artwork and other just kind of energetic things. There's a bunch of acupuncture charts throughout the room too. And so it's a nice little quieter space. Um, the the patients, I check them out, and then we start putting the needles in. The needles are very small. Usually I'm using 32 gauge or smaller. So they're very small needles. Most of my small patients are getting 36 gauge and smaller, just in case, for people who do know what that means, but they're really tiny. Um, I do a couple of things to try and keep them from noticing the needles. Um, so I do have my either the parent or the technicians distract them. They're always welcome to bring some treats to distract them. The needles go in with a little plastic tube that's called a guide. And the nice thing about the guide is I press down with it first. And it's very flat and it's not sharp or anything. So it sort of almost numbs the area so that when I tap the needle in quickly, the patients almost never notice. Um, there are some areas for people who've had acupuncture, some areas are more sensitive than others. So we kind of see how they do with those, and I'll adjust as I need to. Sometimes if the pet is super sensitive to an area, I'll just avoid needling those areas. A lot of a lot of pets are very sensitive on their paws. There's some really good acupuncture points there, but for the patients who just are like, no, do not touch my feet, then I just, all right, we'll back off. We'll go
Yeah.
elsewhere. I can
Yeah.
do other places. It's fine. So I adjust to their needs. Uh, Unlike people, it's really, you can't tell them to just lay there and not move. So sometimes they do walk around a little bit or sit, you know, fidget, like they'll be sitting and then they'll stand or they'll lay down. So occasionally with movement, it can be a little painful if the needle just twinges something, but usually they just kind of go right back to the last position they were in. And I'll either remove the needle if I need to, if it still hurts, or they relax once they've, moved the needle back to where it's supposed to be. So the vast majority do very well. They don't really mind it. Um, I've, had acupuncture myself many times. And they're, I think everyone that I've ever gone to, I've always felt has been very gentle. Um, I've been told that I'm very gentle with my
Good.
needles, so
Yeah. Now, how long does
but
a
yeah.
session take if you're, say, treating a dog with some back problems, some hind
Mm.
quarters issues? Like, how long would a session take? Would it be an hour, 15 minutes, longer?
Yeah, so the acupuncture itself is about 10 to 15 minutes, depending on age of the animal, how will they accept the needles, and a few other factors. The appointment itself, the initial one, it takes a lot of time because I take a lot of history and we go in depth on history and symptoms and some constitutional questions. Are they more hot? Are they more cold? What are we eating? What medications are we on? What supplements are we on? What issues have we had in the past? How is digestion, and all of those other kind of very in-depth questions. And so those initial ones are an hour, and then the follow-up sessions are about a half an hour, and about 10 to 15 minutes of that is actually sitting with the acupuncture needles in.
Oh, fantastic. So I really definitely have, kind of a great idea. And I would imagine too, when you said you go into the room and there's crystals and charts and
Mm,
it's kind of dim and everything, I think that that's even more for us. I think because if we're in there with them and they're feeding off of our energy, I
hmm.
always know when I bring my dog in for something, if I'm flipped out, and you have
Yeah,
different, you
absolutely.
have your wellness visits, and then you have when your dog is not feeling well, and if you feel that tension, there's no question
Mhm.
that your dog is feeding off of the energy that you have.
Yeah,
That's
100%.
yeah.
They smell our emotions, they feed off of our energy. Um, and occasionally I will use that, the owners that are extremely anxious, we talk about that, and how, their energy really changes how their pet is responding in the room. And so we'll kind of, work around that. And sometimes those pet owners will step out just so that they stop changing, how the pet is
I've been
responding.
asked to step out, so I
Yeah.
get it. I know I've been
Yeah.
asked to step out because, sometimes if I'm worried about her, about Rosie, um,
Mm,
she's so in touch with me, so she can just look
mm,
at me and pick up on it like that. And I was also reading about this fear-free pet handling that
mm.
was on your bio, and I thought, wow, that's something I definitely want to mention. So talk a little bit about that. What is it exactly?
So it is a certification that you can get, and it's for veterinarians, and it's also for other pet health workers. I think there are behaviorists. I'm sorry, I should say trainers that are like dog trainers that can be fear-free certified. I want to say even groomers and other like people in the pet industry that the
Wow.
certification they tailor it to each group, so it depends on which group you're in. Um, but it's essentially a long CE course that teaches you how to minimize the patient's fear and stress at vet visits, and any other stressful events. So it is more conventionally based, but they do use some um, holistic modalities, mostly supplements. Like they focus a little bit on calming supplements. So I kind of take it a little more in our direction. I'll also add in herbal remedies, and energy healing can be a big part of it. So, uh, but it's essentially learning how to use your energy to help calm the pet, how to teach the owners to control their energy to help their pet, and then using different methods. So, for instance, anytime I do have to give any kind of an injection, or even the acupuncture needles, or like do something scary like a nail trim, I encourage my technicians, I encourage my pet owners, let's grab some treats, let's see if we can distract them. I think pretty much every puppy vaccine that I do, I give them some kind of a treat so that they don't notice. And my pet owners are continually amazed that their little puppy is just sitting there chowing down while I'm giving them a shot in their hip, and they don't even flinch. They just keep eating. So it's just a really good way to keep them from getting stressed out for those things, so that they don't start to associate going to the vet with these, scary things, and these painful pricks and all of those things, so that
Yep,
they are
shaking
calmer here.
syndrome, white coat syndrome.
Yeah.
It's very
Yeah.
nice to debunk that myth and have somebody who's so, conscientious of
Yeah.
changing that energy. Now, also I was reading, and I think it's so important for people who have cats to know too. There's a lot of things that cats get that are, obviously just exclusive to felines, and you kind of specialize in some of those things. So talk a little bit about that.
So I have a lot of experience with treating feline infectious peritonitis, or FIP. So I do actually have a blog post up on our blog that goes very in depth, that's geared really towards pet owners and other veterinary professionals. So this basically is an infection from a coronavirus, not the one that causes COVID, but one that's
Wow.
specific to cats. hmm So it's been around for, we've known about it at least for decades, and there's been no cure for it. Every cat that got it died. That was how I was taught in vet school. Um, I think that's just starting to change in recent years. But back in, I think, 2019, Dr. Peterson over at UC Davis Vet School did some studies, and now a number of studies on a couple of antiviral compounds, one of which is actually related to the COVID drug remdesivir. So those drugs were actually found to cure these cats, and it's still not available in legally in the U.S. for cats. So there's a lot of difficulty in because of that. But the drug actually really saves lives. So we're hoping that at some point it becomes legally accessible to us, and that we can prescribe it for pets, because at this point veterinarians still can't prescribe it. Um, but we can support patients who are finding it through other means, with just exams and blood work, and just supporting their needs while they're going through treatment.
Wow. Wow. It's so amazing to hear so many things that you are so ahead of the curve on. It's
Thank you.
it's very, very inspiring, and I'm so happy to be able to have had a little time with you. I know you have patience, so it's like I'm like, I got to get you back to your patients. I got to get you had like a half an hour window, but it's so awesome to have you on, and thank you so much for taking the time. By the way, if people want to get information on you, information on longevity, holisticpetcarenj.com is the website to go to. You're there, with your lovely, sweet little, beautiful Pitty.
My
So you,
pity.
your little Pitty. So you're
My
Pitty and your kitty
baby.
because you have a cat too, right? So you're like a Pitty owner and a cat
Yes,
human, and,
yes,
and that's fantastic. Absolutely
yes.
fantastic. Dr. Fiorenza, thank you so much. I have learned a lot. We will see you soon at Longevity, and thank you for all that you do. It's been a really, really amazing segment to be able to get associated with all of these great things that are happening in veterinary medicine.
Thank you so much. It was a pleasure to see you guys.